Good evening, ladies and gentlemen. Thank you for attending our KFAS Inspo talk. KFAS recently launched a new speaker series called KFAS Inspo, which aims to showcase local speakers who have accomplished significant achievements at local, regional and global levels, highlight their journeys, and to inspire and motivate youth to increase their passion in science, technology, and innovation. It includes dialogue with local speakers who are successful in those fields and who contributed to the state of Kuwait and the development of its scientific institutions. Tonight, we're very proud to have Dr. Waddah Al-Refaie, who is the John Dillon Professor and Founding Individual Chief of Surgical Oncology and Surgeon-in-Chief of the Lombardy Comprehensive Cancer Center at MedStar Health and Georgetown University. Dr. Waddah will be giving an inspirational talk where he'll be sharing his stories on leveraging adversity and failure and using them as powerful learning tools to reach success in life and career. Dr. Waddah will go through a presentation followed by a discussion. So you're encouraged to ask questions during the discussion so that we can learn and benefit from this session as much as possible.
Good evening, and thank you very much for the honor and privilege of this presentation. I'm very honored to be one of the KFAS Inspo speakers. I submit to you this is probably one of the highlights for this year. I want this to be very informal and interactive, so feel free to stop me at any time. I think this is an important topic to share with you, how adversity is something we all go through and how it can be used to transform to success. So the first thing that one can ask, why do you want to talk about adversity and why is it important? Let me share with you, how does success look like? So when at least myself and others think about success, success looks very, very nice and relaxing. And in fact, it looks beautiful. This is one of my all-time favorite cities, San Francisco. And this is how, at least I think of success, as a very happy scene. And in fact, most people will think of success as an easy, straight path from point 0 or 1 to reaching success. Reality is that success is a highly convoluted path. It's full of failures, it's full of mistakes, and it's not an easy route. So therefore, adversity is very important that you get your hands around it, understand it very well, and use it to your advantage, regardless of your age and your position and where you are in life. So when I'm asked about my journey, I think of influencers who shape who we are. And we all have influencers in our life that shape how we think, how we interact, how we execute, and how we move forward. And this is an evolving journey. So for myself, it's parents and family. My late father is a self-made success. He believes in adversity and positivity. My mother is also self-made success, a believer in academic education for women and for all. So this upbringing is very important, how I view everything around me and how I view adversity. Another influencer is I'm a product of Kuwait's public school. So I went to Al-Ghazali for Ibtidai, Al-Shweikh for Mutwasta, and at that time, Thanawiyat Kayfan. And at that time when we were at Thawat Kayfan, I think that was a factory for many leaders and ministers throughout the history of Kuwait. So I owe it to Kuwait for the public schooling that shaped who I am moving forward. My initial goal was to join Kuwait University to the medical school because it was one of the best, or is one of the best in the Middle East. But the invasion of Kuwait at that time changed the plans. And this reshaped how I think about it, because you can plan your journey to a great level of details, but then life brings a twist around it. And you have to understand how you have to think and deal with it. Those are realities. It's not your fault and anybody's fault, but it's just the way you have to think about it. So the experience in Dublin, Ireland was excellent. The plan after that was to work in the United Kingdom. However, my late father summoned me to come back and be in Kuwait. And I've asked around, where's the best place to train in surgery, because my interest and passion is surgery, and I was told Amiri Hospital. So at that time, the dean and the chairman of surgery was Dr. Khilal al-Sayr. Emails were not very sophisticated, so I wrote to him, I called his office, and didn't get any reply because people are busy at that time. I remember his assistant told me, if you want to find Dr. Khilal, come at 6 a.m. in the morning. And you'll find him. So I went to him at 6 a.m. in the morning. And of those of you who know Dr. Khilal, he told me, "Shtabi fini." So I want to work here. So he took me And I remember very well, it was a very robust training. It was دكتور خلال الساير, دكتور نائل نقيب, الله يرحمه, صباح الحديدي, الهيفي, وطالب جمعة, a very rigorous year and a half, just a few kilometers away from here at Amiri Hospital. And it's because of this experience, they've actually opened the door for me to go after that to the University of California in San Diego. I think this clicker is not working here. Yes. So the experience in San Diego was critical for my surgical career. The mentors there were Babs Musa, who passed away, and I'll tell you all about him, Dr. David Hoyt, who's the executive director of the American College of Surgeons, and then the late Dr. Marshall Orloff. In surgery, mentors are extremely important, that they shape how you think and how you move forward. This experience then led me to train in surgical oncology at cancer surgery at the Premier Cancer Center at MD Anderson, Houston, Texas. And then my first faculty position at the University of Minnesota that set the stage for me academically and clinically, and then now at MedStar Health and Georgetown University at the American Capitol in Washington, D.C. All of those are influencers. I think mentors are very important in the life of an academic physician or an academic person, whoever, wherever they are. And last but not least, I'm a believer that leaders are not born, but they're made. So throughout my faculty position in Minnesota and then at Georgetown, I was put through rigorous leadership training and worked closely with a coach themselves. And these experiences have actually influenced how I think. I bring this up because you want to understand what academic surgery is. Academic surgery is a discipline under pressure. There's no secret. Surgery, you have to be comfortable with uncertainty. It's not black or white. It's a gray area, and you have to deal with that all the time. Number two, surgery is a discipline where you have to constantly think about what you do, provide yourself feedback, and give feedback for other people. The field we're in, we break bad news. That's something we have to deal with all the time. It's not fun to do that. Break bad news for families, break bad news for the people you work with, and then anticipated outcomes. Most patients do well. Sometimes they don't do well, and you have to understand where you go. So you can think about this constant pressure that we deal with. And I'll tell you, you always have to put others first in the field we're in. Patients naturally always come first, but then your trainees, your residents, your students, and your team, all of them have to be taken care of so they can take care of patients. But I'll tell you, I can't think of any other field or profession that can be as rewarding as taking care of patients with cancer and you offer them surgery. In my obviously biased opinion, I think this is the most rewarding field that we're in. So think about discipline under pressure and why this is very important for adversity. Now, there are influencers in life, but there are defining moments. So we all have our defining moments that influence how you think about what you do. So I have 10 defining moments in my life that I think shaped who I am. Some I've handled well, others I could have handled better, but let's go through them. Number one, the struggle between ability and family name. So all throughout the public school in Kuwait, my ability to perform was always biased around my family's name. That's the reality. I push very hard, and there's always my ability versus the family name. So what happened, I kept pushing very hard and working even harder. So it has the advantages, but it brought disadvantages with us. The invasion of Kuwait, a striking moment in everyone's career. You make decisions. What do you do? It shakes you to the bone. It changes what you do. It's a life-defining moment for those who went through it. I lived 9/11 in the United States. My mother and sister were trapped in New York, and then I had to live in the States after that. And you have to remember, being an Arab Muslim climbing through the corporate leader in America is a very, very life-defining moment for me. But what it taught me is you develop tough skin, you can't be sensitive, and it develops empathy. What I learned from this experience, it gives you empathy, how women in academia go through, how minorities go through, and others. And it leads to one simple fact. If you have to provide excellence to make it all the way through to the top. Without that, you cannot survive. And excellence is key in those highly competitive opportunities. Another, in the spirit of women, I'm a big believer in strong women in life. So I admit to you, I married up, and probably my wife married down, but I'll tell you, she made me a much better person. Another life-defining moment that women are strong contributors to society and life and education. Now, defining moments. The next one is the death of my mentor. That was a very, very difficult thing to go through because mentors in surgery are your mentors first, and then they become your friends. So before his death and when he was diagnosed with his cancer, he actually called me to give a second opinion for his illness. So the roles have reversed from being the student to the friend to consultant. And when he passed away, that left a very, very difficult time for me because now this is the person that you confine with, you talk to, and you get opinion. But then you have to use all what you learn from them and move forward. Another life-defining moment is the death of my father. It was a very, very difficult episode that I had to go through. So I'm a cancer surgeon. I do complex operations. I deal with end of life. I deal with bad news. And yet, this was a difficult time that I had to go through. And because the issue that I had to deal with, that I was unable to help him at a time when he was dying. So for a cancer surgeon, those are life-defining moments. At the same time, I had a son who was born around the same time. I named him Bedr in honor of my father, and he became a daily reminder, a happy reminder of him. And then his legacy lived through my son after that. And as a surgeon, one of the worst things you go through is the death of your first patient. Surgeons are planners by nature. They plan every detail for the patients. And this happens. And I'll tell you, I still think and remember this episode. The death of my first patient. It shakes you all the way through to the bones. Not to say that the second death is easier, but those moments are very, very important for surgeons to remember and clinicians. They're not easy. We may hold our emotions to ourselves, but you have to learn from them to move forward. Career rejections and setback. I remember about 5 or 6 years ago, before moving to Georgetown, there was a job opportunity that I thought it was for me, and I didn't get it. I was extremely disappointed. I went to my wife and I told her about it. So I thought my wife was going to say, you deserve it, you should have gotten. No, I got the advice, you're not ready. And I was shocked for her to say that because I thought, you know, you're my wife, you should be on my side. She said, no, maybe you're not ready. And this is the kind of advice you need in life through adversity, is advice that you need, not advice that you like. And last, every few years as a leader, we go through 360 evaluation. So my boss, the people I work with, and people who report to me, they get anonymous feedback. And then it's always, always an awakening moment between how I feel I treat people versus how people perceive you and how much you can close that gap. And it definitely made me a much better person over the course of time. So this brings me to adversity, failure, and setback. Why do we want to talk about it? It's rough and it's challenging. They're never easy. There's a cascade of emotions that you have to know that it happens. When you have failure, setback, or a disaster in life, it never ends. So the expected emotions, you become avoidant or you escape reality. That happens. You're angry with the reality itself, anxious, or blame. You blame yourself or you blame others around you. The response and consequences, if it's not handled very well, when adversity strikes, people can derail their careers and end up in a disaster after that. They can have a personal discourse and family discourse. And last but not least, their general and mental health can decline. So they may sleep less, eat more, engage in drinking, and then derail all the way through. So adversity, when it strikes, if it's not handled very well, it's a slippery slope. So it brings me to the concept of resilience. Through leadership training, we've learned that again and again. And surgeons, it's very important to develop the mental muscle that gets you through adversity. Because everyone went through adversity in this room. You've been through it, you're going to go through it, and you're going to go through it again and again. So this is not a new concept for anybody, but it's just how to do it. So building mental resilience. How do you respond quickly and positively to crisis? Number 2, remember, failure is common. Bouncing back is uncommon. And that's where you distinguish yourself versus others. Because why is it very hard to bounce back? Emotions are high, and there's external pressure between perception, stimulus, and the feedback that you get from others. You have to think about failure as the beginning and look at the future and learn how to reset your thinking to a growth mindset and then a response-oriented training. And I'll walk you through some of the concepts that we will learn from it. So this summer, our CEO gave us a reading book. So we were in a leadership retreat. And this is the letter that he handwritten note to all of us. Thank you again for the participation in our Leader of the Future alumni event. based on feedback. This is a very highly relevant and book that I enclose to you, written by Carol Dweck, for resources to transform your life from a fixed to a growth mindset. And this book actually rechanged how I look about things. We were semi-mandatory to read this book throughout the summer. Actually, as much as I want to thank her for writing this book, I think she should thank me because I bought this book and I gave it to all members of my team and asked them to read it and asked the students who work with me to read about it. And let me walk you through the most important element of that. So there are two mindsets. So in general, when a crisis strikes in life, this is the fixed mindset. So you have a challenge. The fixed mindset tells you avoid it, escape, travel, leave it alone. The growth mindset will force you, which you have to fix your mind and think about it, embrace the challenge and take it on. The fixed mindset when it comes to obstacle is give up early. No. Think about this as if you're lifting weights in an exercise. Persist in the face of setbacks. What about efforts? Efforts in a fixed mindset, you see them as fruitless, waste of time all the time. However, if you develop a growth mindset, you see them as part of the path to mastery. The more you persist and the more you try, this is where mastery is developed. What about criticism? We always get feedback. Sometimes you get good feedback from the people you despise, but that's just the way life is. Not every time I get feedback from someone I like, but that's feedback. You take it, you separate the person who gives the feedback from the person who gives the feedback. So you can ignore it, negative feedback, but the growth mindset is learn from it and learn from criticism. And last, what about success from others? So when a crisis strikes, you will view success from others as you're threatened by them and elements of jealousy. But you have to think about it as what can I learn from them? This exercise has actually made us rethink, because in leadership, dealing with patients, dealing with people, crisis happens all the time. And you can easily slip, even the expert, into the fixed mindset mode. So you want to challenge yourself to move to the right side where you develop a growth mindset. Another exercise that we, over the course of time, learn is how you can move from a response-oriented mindset that's based on control, impact, extent of crisis, and duration. Surgeons like control. We like to have control of the situation all the time. Impact is very important. So what's the exercise? So in control, a cause-oriented or a fixed mindset make you think, could we have prevented this? What did I contribute? But in a response-oriented thinking, you want to think, what can I do to improve? So for impact, you want to ask yourself, what can I do to improve on this situation? The extent, the initial response is always, this is a disaster, the sky is going to fall, bad events will happen. You have to ask yourself, what can I do to minimize the negative aspects of it, and if there are any unseen positive effect of that. And then the duration, is this transient or not? Let me share with you a couple of leaders that have developed resilience over the course of time. So Winston Churchill had disasters in his political career, one after the other. But listen to what he says. Success is not final. Failure is not fatal. It is the courage to continue that counts. Now, I think very highly of Winston Churchill as a leader. He has poor eating habits. He didn't take care of himself. He drank a lot, smoked cigars, didn't sleep well. So there's some parts of the life. But as a leader who persisted in the face of resilience, he presented a lot. And this is one of the all-time favorite times. If you see, success consists of going from failure to failure without loss of enthusiasm. So that's resilience, and that's grit. And it's very important to keep that in mind. So what about overcoming and bouncing for failures? So if you ask around common CEOs and highly rewarded people who went through failures and setbacks in life, you have to understand the emotional cascades. It's not unique to you. It's a human response. Either you allow it to consume you or you consume it, preferably the latter. Number 3, you want to believe, why not me? Not why is it me? And this is normal human response, that when a crisis happens, you always think, why not me? Why me? Why not the rest of the world? But when you ask resilient people again and again, how did they bounce back from failure? Number 1, they accepted reality. Number 2, they believed in a calling and purpose. They never gave up. And number 3, they improvised in crisis. They came up with a solution to get them off the ground and to move forward with that. But importantly, they seek and receive real feedback. So you don't want to get feedback from someone who's going to give you nice, pampering feedback. You want to get feedback that you may not like, but it's important and honest. And that's a very important one. Who doesn't know the Iron Lady? This is what the Iron Lady said. Any leader has to have a certain amount of steel in them. So am I not that put out being called the Iron Lady? Resilience, grit, one of the all-time famous resilient leader in the history of the world. So if you ask around how the best of the best get better, this is a famous saying by President Truman of the United States: if you can't take the heat, get out of the kitchen. So number one, the best are made, they're not born. Number two, they excel under pressure. Pressure is a reality that you have to deal with. Number three, they focus on long-term goals and aspiration. They train and surround themselves by those who push them to get better, which is not fun sometimes. I surround myself by people who are smarter than me. I may not like it, but they push me to become better. They reinvent themselves and they seek real feedback. And when they do well, they celebrate, and why not? So here's some lesson learned from my failures. Number one, I had to change how I think about it. Failures are not personal. It's just part of life. Brutal reflections on how to improve. Very important to take some time, not to escape and avoid reality, but to think through how to reflect. Seek real expert feedback. So when I go through a work-related or a crisis, I ask people who know. They give me feedback that I dislike, but it's honest and it's real feedback. I read a lot, I plan a lot, and I journal a lot, because it forces you and reset the brain chemistry to think in a positive way than going through that slippery slope that I just showed you on the left side. And then you got to take care of yourself. And I'm tempted to say before or then loved one. And I go back and forth. I think you have to take care of yourself in order for you to be strong enough to be a crisis. Sleep, exercise, food, and relationship. And last, I think one of the most important things for leaders, they need to get a leadership coach, because it's very transformative in terms of how to think moving forward. Again, thank you for this honor and privilege. It's an honor to be with you here in KFAS, and thank you for the invitation. I'll stop here and answer questions for you.
Thank you, Dr. Waddah, for this enlightening presentation. But I wanted to know, you said that you've got pressures through the way, and the outcomes of patients are not always positive. So what makes you push through it when you don't get a positive outcome from patients? What makes you just say, you know what, I'm not going to stop myself? What's the next step that you do?
Yeah, so unfavorable outcomes with patients can happen due to a variety of reasons. Some are aspects that you can do better. Others are not outside our system-related issues, and some are related to the patient's biology or the disease itself. At the end of the day, the commitment to patient care trumps everything else. So you want to come back again and say, we're going to do better for the next person. And that's what's important. And that's what drives you to push forward and how to take it from this point to a much better point after that.
Thank you, Dr. Waddah. Just a quick question. You touched on moving from the fixed mindset to growth, which probably, if you're able to elaborate, how can you apply adaptability into a surgery that you have experienced?
Yeah, so to move from fixed to growth mindset is not an overnight process. So it's not going on a crash diet where I'm going to tomorrow start a fixed mindset. This is a process that takes a long time, where you have to think about it carefully, work with a leadership coach if you have, and work with it. So it's not that I'm going to have a crisis tomorrow and whip my fixed mindset. This has to be something that you have to use and train until a setback happens and it becomes a natural thing that you deal with. And remember, crises are not easy to deal with. The emotional response takes over you at the beginning, and you have to do your best not to let it consume you.
Good evening, Dr. Waddah. My name is Abdulrahman. I had met you around 6 years ago when you came and spent a week in Amiri as a visiting doctor. And it was very interesting to me that you, as a person who trained in Amiri initially, was actually being invited by the country to come and give their expert opinion. So my real question is, you've faced all these challenges in the States, and thankfully you've excelled to something that makes us really proud. So do you think there's another challenge to come back and apply what you've learned in the States back in Kuwait?
Yeah, thank you. I'm always asked this question, and my response is I continue to help Kuwait, and I'm very proud of Kuwait, whether I'm in the States or here. I'm constantly working to help patients, students, and trainees, so that never ends. Probably the impact is just as good or stronger. So the commitment and pride to Kuwait never ends, whether it's here or there. Yeah.
Just a quick question, maybe implementing that feedback loop in terms of a pediatric oncology perspective, or maybe from someone who's within palliative care, who's terminal. How would you sort of implement that or put that in place?
So there are a couple of mechanisms for feedback. Number one, you have to create a safe environment for the feedback. So initially there has to be no negative repercussion for feedback that's given. In general, it has to be anonymous. So I don't know who's giving me the feedback. So it could be from the patients, their family, colleagues, or the leadership as well. And you gave it from a 360 response as well. You want to benchmark it to excellence. That's very important. And then you have to use small pilots with intervention, learn from mistakes, and reapply it again. But it has to start with the premise where you're using the feedback to make you better, not to single out individuals or units to bring them down. Yeah.
What's your the 3 most important advices for final year medical students?
Sure. Yeah. So a very stressful year, very important year. I'm not telling you any secrets, but I think if I reflect back and redo it again, so I think. This is the year that defines the future for you. I think preparation is very key, and then it's not last-minute preparation. It's very early preparation. So think about this as a long-term investment that starts from now. So preparation is very important. Try and make your mistakes up front, not at the day of the exam. So whatever you want to go through in preparation, do them early and get advice from as many people who are going to give you honest advice as well. But it's a very important year that defines the future for you.
Just dealing with breaking news to patients in general, when you think about different cultures, doing it in the US and doing it in Kuwait, is there a different approach to it?
I don't think it's easier there versus here. I think breaking bad news in general is not fun. It's much easier for me to tell you, you want a $1 million investment, there's your check, right? But when I come and say your cancer has progressed, or your performance is poor, or you need to leave, those are all bad news. But culturally, you have to factor in how to break bad news. And you have to think about culturally how the other side. So in general, end of life and death are very, very delicate situation. So you have to, if you're not familiar with the culture, you have to bring people in. So for example, if I'm, whatever I am, and I'm dealing with a culture that I'm not familiar with, I'll bring someone else who can help us go through the situation as well. So in the US, if there's a Muslim family who's dealing with end of life, sometimes they call me to deal with it. Now, I may be helpful, but sometimes I'm not very helpful. But you have to think through the cultures to do that, to overcome that. And there are ways to do it. You have to be honest. You can't lie. You have to be respectful. And you just have to take your time delivering it slowly. But you have to be mindful of the culture and sensitivity. So words count, what you say. And you have to allow them to ask questions. Don't take emotions as attack against you. It's just they're angry with the problem. They're not angry with you.
Hello, my name is Idris. I'm from Toronto, actually, so I'm glad to be here and attending this event. My question is, what was the best feedback that you've received, whether from a coworker or from a patient? What was the worst one, and how did you take both? Could you explain a little bit about it?
Sure. Loaded question, but I'll answer it. So the best feedback, actually the worst feedback is the best feedback. So the worst feedback is, you don't listen, which is classic for surgeons, right? We want to make decisions quickly. So I had to work on that to actively listen. And then it became my best feedback, is that you sit back, You hear the other side talking. You can disagree with them, but let them say their part and then react after that. I can go through a long list as well, but that's what, yeah. But listening is very important, and not only in leadership, but even with patient, you have to let the other side. And you can, it doesn't mean you don't disagree with them, but they have to finish their part first, yeah. Sir, yeah.
What can you, like, you have a very specialized skill that is very helpful in the US. Maybe it's like Kuwait cannot take that skill, or maybe there are other people who have very good skills or extremely good skills. But then they don't have enough opportunities here, not because there is something wrong here, it's just different market, different country, it's just small country. So what can you tell to such people, and how can they deal with the cases where they have to work outside Kuwait, not inside Kuwait?
You're talking leadership or healthcare? Sorry, I didn't understand the question. Yeah.
Highly specialized people.
Yeah, I mean, I think Kuwait had no shortage of leaders and specialized. The question is to provide the environment and bring the expertise, and it can work. But there are the right elements in Kuwait, no question in my mind about it. It has all the right leadership ingredients for it to succeed.
So the question relates to how students approach graduation.
I'm a student for life, so don't single me out. Yeah, yeah, we're all students for life. Yeah, it doesn't stop. Yeah.
So as people are trying to figure out what their calling is,
yeah.
They go through different experiences, different job positions, different disciplines. Do you have any advice as to how a person needs to recognize what they should pursue as opportunities change, disciplines converge and diverge? So it's people are constantly restless in some positions, and finding that particular aspect that you can excel in.
Sure. So you ask a very good question, because restlessness happens as you move in your career, and even leaders get restless in their positions for a long time because people are ambitious by nature and they want to move. So if they're not calculated moves, they can be poorly managed moved after that. So when you say for calling, the best advice that I received was, what will make you get out of bed and enjoy doing what you're doing 10 years, 20 years, 30 years from now, and not lose your fire? And that's what it's going to end up being to it. So when I get promoted for a major leadership position, I ask myself, what am I going to give up? So I enjoy operating on patients, so I'm not going to give this up at age 47. I enjoy and I'm passionate about my research. So you have to really know what things make you tick or don't, and then be willing throughout the phases of your life to decide what do you want to do less of or more of. And if you feel you need to develop new skills, why not? Reinventing yourself is very important. It has nothing to do with age. You can reinvent yourself at any age or any, as long as you have the mindset that you want to grow and think of yourself as a student for life. But the itch is very common. It's a good itch if you manage it well. It's a bad itch if it's just not through and you go through a slippery slope of making bad decisions.
Yeah. You did mention earlier in your presentation that your family and your parents were very massive influence in your decision making throughout your education and your leadership. If somebody don't have a family that they can depend on, or family that they can look up to, who else do you think could actually replace that? And do you think you've looked into community leaders or anybody else that could get into that?
So I think reflecting on your question, if you look at leaders who excelled, I think the best example to respond to are people who came from single parents background, right? So they either had, or orphans who did very well. So those individuals, some didn't do well because they didn't have the right environment. It's not their fault, it's just the way they're, and some did extremely well. And I think the book that actually hits it very hard is by Malcolm Gladwell, who clearly described that there's luck, if you believe in it or not, but then showing up at the right time and then working hard and knowing the right mentorship or extended. So biologically, we think of family as mother and father and parents, true. That's the most strongest bound that you have. But then communities as well can be relatives, teachers, mentors. They can be your family as well. That's the reason mentors become or coaches can become very, very important. So I, for example, at this stage of my career, I still have my internal advisory board, for example, of individuals whom I respect, I look up to, who I bounce things by every 6 months. You know, I have this issue I have to deal with. What do you think? I'm thinking 1, 2, 3, and sometimes I'm thinking the right path, and sometimes I'm completely off the reservation, and they'll help you bring back again. So family doesn't always have to be, you know, parents. They can be extended family or your community as well. Another example that calls to you are the, I'm considered a minority physician in the United States, right, of being not from the European descent, if you will. And so one of the challenges have always been is that, you know, underrepresented minorities will need coaches and leaders for them from others who deal with that. So that has been even more populated now to help them through the moving up the corporate ladders as well. So family is important, but if not, you have your community, your spiritual communities as well, people who you surround with. It's just someone who gives you honest feedback, not feedback that makes you feel good only.
شكرا دكتور وضح المحاضرة. سؤالين إذا تفضلت. السؤال الأول، هل قدمت لك كلية الطب بجامعة الكويت عرض أنها تستثمر مهاراتك في التعليم وفي التدريب الطبي في الكلية عندنا؟ وهل إذا كان الجواب لا، هل لو تم تقديم مثل هذا العرض would you consider it؟ هل ممكن تفكر أن تنضم لنا في الكلية؟
The way I look at this is we're always ready to help. We always work with students. We're actually thinking about many projects to help the students. The way I look at it is students always reach out. We're always willing to help them. So the door is always open. Yeah, thank you. Yeah. Dr. please.
خليني أوضح أخذك شوية for history.
Yes.
In the 90s. يعني أنا that time 1997 I was director of American hospitals. I think you started your residency in surgery.
July 2nd.
I can't go for that, but it was 1997, huh?
Right.
And
you signed my papers مع الدكتور النوري الله يرحمه. He signed. Yeah.
يعني you were a model.
Thank you.
You were a model from what I hear from the Khilal side. You know, Khilal was the chairman at that time in the American hospital. But I think at that time you faced many obstacles. And I saw, some drawback in your early days. But you are fighters, and you are one of our champions that we are proud. I think we need, a real advice for the young physician surgeons in the early days. How can they face their struggles? How can they, align their future? How can they decide? How can they get through the long journey to be, specialized and to reach, that level? Although, there's a lot of, it's a cultural issue sometimes. Politics sometimes can be combined with this issue. The Prussian jealousy sometimes can demotivate some of the youngsters. So, what's your real advice?
Sure.
If you face that struggle, and you face it really, and even, I think at that time, even, you tried even with the university, and even there was some few issues with the university. There were some obstacles to. So can we have, real advice? Since now you are a role model, and we are proud that we have, such high caliber surgeon, and doing an amazing job and effort. So please, can you just advise them, sir? Because I think they need this real advice. They want, the guidance. They want the role models. To follow, your path. When you start your early struggling days in your early future until, you reach that level of excellence.
So first, thanks for your kind words. I think struggles are just part of surgical trainings, and that's what builds mental muscles. I don't think it's unique to another place. I think, so that's number one. But I'll respond specifically to your question. In surgery, mentorship is very important. To think that you're going to go through surgical training with zero struggle is a fantasy. It's just the nature of it. It's a high-pressure discipline that requires commitment, sweat equity, all in, and you have to take care of yourself. So mentorship becomes very important and being part of a structured process. So to make it think that you're not going to struggle at all is not real. It's just part of what we do. So I think mentorship becomes extremely important, and that's what we focus on all the time, is that align people with mentors to help them go through it. But it's reality. It's just part of what you go through. That's the reason I mentioned, it's a discipline under pressure. It's not a discipline under pressure, especially in surgery. It's not easy to go through. So mentorship is important, and then creating a path of what it needs to take over what course of time and what things to do. So the things we deal with residents and students, for example, on the various specialties, we tell them where to apply, what to go through, open doors with other people with contacts for them, connect them with other people who can do it, and then understand it's not easy. It's just part of what you go through. And actually it makes you a better person. So maybe when I was struggling at that time, I didn't handle the struggle very well. Maybe I didn't know that, so, right? Yeah.
Thank you, Dr. Waddah, for your talk. I'm just wondering, you said you had an early interest in surgery after graduating from RCSI. And my question is, how important do you think your experience was in your first surgical rotation in helping guide you whether or not to choose surgery as a career? Because I hear from lots of colleagues sometimes they really like a specialty, they go through a rotation, they end up hating it because of, say, team dynamics, etc.
Yeah. So my interest in surgery is actually delayed. The reason is my surgical rotation was the last one. So I was set on doing something else completely different until I did surgery last. And I think from your question, I take it you're students or physician who are familiar with it. So surgery gets a very bad reputation as a rotation. That surgeons are difficult, they keep people late, they bring people early in the morning, they're hard to deal with. So those reputations on that hand. So I think rotations are extremely important as mentor to influence the students, to make it not necessarily, it has to be to show what are the positive aspects of surgery. So yes, team dynamic is important, but if someone feels that that rotation was not informative enough and they can do a rotation somewhere else or ask other surgeons about it. So my interest developed late in medical school because that rotation was the last few months. So, and then that's when my interest picked up. But I can see completely if the first rotation in surgery was not a positive one, it may have impacted it. But the second one was equally good, and the third one was not as good, but the opinion. But when I came back to Kuwait, and I specifically wanted to be in a very busy unit. Amiri at that time was the busiest unit. It had a robust department of surgery, and that reinforced it in a different manner. So yes, it's on the person as well, but the team have to do a good job to present a good picture of the team dynamics. Yeah.
Excuse me. So just one last question.
Yeah.
Nowadays, it seems to me, you did mention about feedbacks. Feedback's very important, but people actually don't like feedbacks.
It's human nature. No one likes feedback.
No one likes feedback. How do we actually try to accept feedback? How do we customize ourselves so that, and try to understand this feedback is what to help me or to shape me to be a better person? Like, how do we do that? Like, that seems to be very challenging for the entire society, regardless of where humanity is.
I think, accepting feedback is hard. That's human nature, but it has to start within self. So if you view feedback as criticism to bring you down, then you'll always view feedback as it's going to bring you down. If you solicit feedback to make you a better person or a practitioner or a physician or a researcher or whatever your field is, you're going to look at it differently. Now, there are always some cultural differences that people don't want to expose each other's feedback because they can be viewed as weak. But it's not considered weakness anymore. It's actually considered areas for improvement. So when I sit with my team, I actually ask them, how did we perform? How did we do by you? So when I sit with the students at the end of the rotation, I ask them, how did we do by you? So if they say, it's a great rotation, thank you, Dr. Refaie, for doing a good job. But sometimes I don't hear that, right? We may hear, you were tough on us. But when I ask why, there's some areas that I can change, then I ask for the feedback. I want to know and do that. So you have to really take it with a very open mind, that it's to improve you and people who are with you. And remember, if you don't take feedback seriously, you may not be a pleasant person to be around, but you don't know that, right? You just don't know that. Until you do the 360 and do an anonymous evaluation, you can see what's your impact on others through those evaluations. So we're always, there's always those dynamics about how you get perceived and versus how you conduct yourself. So it has to start from you, is that feedback is something to make you better. It's not a weakness or a handicap, if you will. Yeah.
Thank you for the presentation, Dr. Waddah. As you said earlier about a student for life and everything, my question is, in terms of medical technology and new procedures or new ideas come in, is it difficult to follow up with all these new ideas, or is there a certain path that you follow that can to help improve?
So I think we all in our areas, we have to keep up with the latest, and you can do that through several paths. If you're involved in research, that will force you to be on top of the latest. So that's number one. Attending your annual or society conferences is a way to keep yourself updated. Medical journals that we have is another avenue to keep yourself engaged. And you have to make a decision in your career earlier on or later on, is how general do you want to be versus how specialized you want to be. And there are pros and cons in either approach. If you want to be very general, you may end up knowing a lot more, but more superficial. If you become more specialized, there's depth and expertise and less information about other areas. So that's the balance you have to choose.
Yeah. Well, you've had the experience of both Kuwait education as well as American education. It seems that Americans emphasize more on team building, leadership. They really try to push you in your career to reach those peaks. Do you think that's lacking in Kuwait? And if it is, what advice would you give to the organizations to make mentors or to make leaders?
Yeah, I mean, it's hard for me to comment on that. I haven't worked in Kuwait for a long time, so I can speak for the environment that I'm at the moment. But it's hard to say what's lacking or not at the moment. But I have full faith and optimism that Kuwait and Kuwait youth, that they can reach the potential they want. Yeah.
Throughout the talk, you emphasize the importance of being resilient. Being able to stand up after you fall down.
Yeah.
So, personally, I fear failure a lot, and I even take my motivation from this fear of failure. So, how can, if you were to fail, what's the best way to stand up again? Is it to change your mindset, or is it to surround yourself with supportive people? Based on your personal experience, what do you think is the best way to improve this?
Yeah, so so very good question. I think when you fail, or when we all fail, it's hard to think of failure not negative. It's a normal response. I did a bad job, or I had a failure, or I had a career setback, or I'm dealing with crisis. You really have to really work on resetting how you think about it, that what can I learn from this? What can I do better? And how can I move on to the next one? So you pull yourself out. And part of it is seeking help from others and getting expert help with that. So there are leadership training, there are coaches, there are books, and there are others who fail. And remember, your failure is not unique to you. Others people fail, but they just don't say it. And so when I get calls from other friends in other universities, and they deal with crisis, they'll be surprised that, no, I actually dealt with this 5 years ago, and your failure is not as bad as how I dealt with it, and you've handled it. So it's a lonely feeling sometimes, and we'll only be lonely by not asking others for advice.
Going
going back to the growth mindset, but I'm going to narrow it down to adaptability. I mean, as a surgeon, I'm guessing, and you touched on it, efficiency and following specific procedures are very important within a surgery. But how can you apply adaptability and improvising with uncertainties within a surgery?
So we factor in uncertainty in the world we're in. So in general, if you're doing, let us say, a complex operation, as a team, we run through all the possible scenarios, 1, 2, 3, 4, and then we factor in some uncertainty that you have to deal with, what we call intraoperative judgment. You go in, you're encountering something that you didn't think through, you have to make a decision, you call a colleague to get a fresh set of eyes. Sometimes a colleague will call me to get a fresh set of eyes. You stop, you review the case, you see what did you miss, and then you go back again. So it happens. You just don't want to make uncertainty very high. You want to keep it low to minimize the issues. Yeah.
Okay, so we have come to the end of this talk. So we can network outside, and on behalf of KFAS, we would like to thank Dr. Waddah for being part of the KFAS Inspo series, and thank you for attending tonight.